So today we'll be talking about how to write a clinical case presentation. How to write a clinical case presentation. So for most case presentation, they are written using a PowerPoint because PowerPoint has some features that helps in presentations. Yes, in case presentation, it deals with um, oral performance. Oral performance. So we normally write case presentation using the PowerPoint because it has some features that can help you present effectively. We don't use Word or PDF in case presentations because for Word, when you are presenting anything using Word, there can be um, some scenarios where you can then press on edit and edit something else whilst you are presenting. So to remove every constraint or any difficulty during presentation, we go for a PowerPoint, which is the best in writing anything for presentation. So for case presentation is a structured way to describe a patient's medical situation. Is a structured way to describe a patient's medical situation, often used in a clinical or educational setting. So a case presentation is a structured way to describe a patient's medical situation, often used in a clinical or educational setting. And normally, case presentation, the key components of case presentation, the patient introduction, that's a brief summary of the patient, including the demographics, chief complaints, and relevant issue, history and findings, medical information, diagnostic plan, treatment plan, and critique and conclusion. So these are some key components you can find in case presentation. And there are some case presentation, some organizations or institutions might give you the parameters, the things that you have to follow to write those case presentations. So today, we are coming to look at how we can write a case presentation using some certain structures, some certain what parameters. So the first thing we will talk about is the patient's particulars. So the parameters or the things that we are following to write the case presentation, that's what we are coming to talk about. So the first one we will talk about is the patient's particulars. The patient's particulars meaning the first thing we have to consider is the patient's information, which can include the age, the sex, whether a male or what, a female, the occupation, whether a driver, a trader, a banker, a nurse, a midwife, a doctor, a medical technician, or any other occupation, and the educational background, whether the person is a JHS graduate, a senior high school graduate, a university graduate, or anything else, whether the person didn't even attend school. So these are the things you can include in writing the patient's particulars. So in writing the patient particulars, you can also add other relevant information as well, like maybe where the patient also stays is kind of relevant. But for the patient particulars, there are some minor irrelevant things that shouldn't be added. For example, they give the patient like best. The food the patient like best is irrelevant here. Maybe the color of the house the patient is staying in, the type of television. Those things they are very petty, like they are very minor to to be added in, yeah, to be added in the case presentation. So the next item we talk about, so the first one that we will include is the patient particulars. The next one is condition, the condition of the patient. So in writing the condition of the patient, the thing that you have to include is the compliance, that's the complaints of the patient, assessment findings. So assessment finding normally is based or it is done objectively. That's you observing it and assessing to get some findings as well. And the diagnosis meaning the disease, trying to finding out the disease of the patients, the lab investigations and the treatment. So these things um I've mentioned, they are all under what the condition of the patient. To imagine the condition, we have to know, or we have to see the compliance, the assessment findings, the diagnosis, lab investigations and treatment. For lab investigation, it's based on the disease or the diagnosis of the patient or the condition of the patient. So normally there are some conditions that there is no lab investigation that was being done about it. So for that one you exclude it. You exclude the lab investigation. For the others, they are kind of constant. The next one is the nursing. Nursing. So the nursing consists of the nursing diagnosis and the what? The nursing management. For the nursing diagnosis, there is a way it is being written using the NANDA. Using the NANDA. Nursing management is how you were able to manage the situation. What you did. What are the things that you did to monitor the situation or to help the person in being well? The things that you did, that's the nursing management. What makes the case special? What makes the case special? So, in writing the case presentation, for this structure that we are using, we have to include what really makes the case special. What makes the case special? More of if more of it will be like, why were you interested in presenting this case? What is so special about this case that you want to present? So, what makes a case special must also be added in writing the case presentation. The learning points. The learning point includes what lessons you learned from the case. Then the last one is what will you do differently if you meet such a case again. So that one will be at the latter parts of your case presentation. Then, so what will you do differently? Meaning, in case such um case that you faced or you are writing about is being admitted at the ward or is being faced again, what will you do to manage the situation for the patient to be well? What will you do to avoid any constraint, to avoid any adverse conditions or to avoid any adverse situation happening? So these are the things we are considering in writing the case report. The case presentation. So the first one, It was the patient's particulars. The patient particulars. So for this one, you have to talk about the age, the sex, date of birth, occupation, education background. And for the age, here it is 55 years, 6 male, date of birth 15th March 1970, occupation commercial driver, education background was junior high school graduate. You can also add a name as well. Yeah, you can also add a name as well because it is very um essential, but you can decide not to add it as well. The next thing is a condition. So we are done writing the patient particulars, so we are coming to deal with the condition. So for the condition, we have to present the patient complaints or the complaints. So the patient was admitted with frequent urination. Frequent urination. So these are the complaints of the patients. The frequent urination, that's the medical term is polyuria. Polyuria. Poly means many. Urea meaning urine. So quote and unquote many urine. So frequent urination was a complaint. Excessive test. That's polydipsia. Excessive test. So for that patient, he or she normally feels tasty or thirsty, wanting to drink water or any other fluid more frequent or excessively. Um, the generalized body weakness, blurred vision, poor wound healing on the right foot. So these were the complaints or the complaints of the patient. The next thing is the assessment findings. So all of these things that we are talking about, they are all under the condition of the patient. So for the assessment findings, the patient was weak but conscious and well oriented. The patient was very weak but conscious, well oriented. Vital signs on admission. So upon assessing the patient, it was found out that the patient was very very weak. You can just see it objectively. You can just see that patient was very weak and the patient was conscious. That means the patient can talk, can respond to some certain things. And also, the vital signs were being checked. The vital signs on admission, that's the blood pressure, the pulse, the temperature, and the respiratory rate. All of them were being taken upon admission or on admission. Physical examination revealed a small infected wound on the right foot with delayed healing. With delayed healing. So these were all some findings we found out from um, the patient. The patient reported poor adherence to previous medications. So the patient also voiced out that okay, there were this medication given to me previously, but they are not really helping. So the patient reported poor adherence to previous medication upon the assessment findings. Because during the assessment findings, you'll be asking the person some questions as well when you find out anything on the patient, and the patient will do so to report to you. So that's for the assessment finding. Diagnosis: the patient was diagnosed with type 2 diabetes mellitus with hypertension and a diabetic foot infection. So this was the diagnosis of the patient. Laboratory investigation, it included the fasting blood sugar, which was 14.2, random blood sugar, that's the RBS, HbA1c, full blood count, and urinalysis. The wound swab showed that bacterial growth was identified. So these were all some lab investigations that went on. The next thing you have to talk about is the treatment. The treatment. What was done for the person to feel okay. The first one, insulin therapy, short and long acting oral antihypertensive drugs. So because the person was a HP patient, a hypertensive patient, the person was given some oral antihypertensive drugs to suppress the hypertension, broad spectrum antibiotics, daily wound dressing, IV fluids. For the IV fluids, you have the NS, DNS, Ringer's lactate, and the others. Diabetic diets and nutrition counseling. So these were the things that were done for the person, the treatment that was given to the person for the person to feel better. So the next parameter we'll be talking about is the nursing. The nursing. So the nursing it deals with the nursing diagnosis and the nursing management. The nursing diagnosis and the nursing management. For the nursing diagnosis, there is a way of writing it using the NANDA. Using the NANDA. So the first one that was being written here was imbalanced nutrition related to impaired glucose metabolism, risk for infection related to hyperglycemia and open wound, impaired skin integrity related to poor wound healing. So like the skin wasn't that good due to some wound which are not being healed. Activity intolerance related to generalized body weakness. So or the person wasn't able to even walk or do some basic activities because he or she was very weak. Knowledge deficits related to poor understanding of disease condition. The person didn't really know what the condition or the disease he or she was having constituted due to lack of knowledge or inadequate knowledge the person had on that condition. So these are some of the nursing diagnosis that was written based on the diagnosis found out, which was the type 2 diabetes mellitus and the hypertensive or the hypertension. Nursing management for this one, it will deal with what was done, what the clinical practitioner did for the patient, what was done, how did the patient, the clinical practitioner manage the situation. So the first one here was monitored blood glucose levels regularly and documented findings. So the blood glucose levels that will consist of the RBS and also the FBS. So the blood glucose levels was regularly being checked and documented as well. We normally check the blood glucose levels using the glucometer. Yeah. Administered insulin and other prescribed medications as ordered because the person is having diabetes, type 2 diabetes mellitus. So insulin was used or administered for the patient because the patient was having a type 2 diabetes mellitus, and insulin is used in type 2 diabetes when other treatments like diet, exercise, and oral medication are no longer enough to control blood sugars or blood sugar levels. So the insulin helps in controlling the blood sugar levels. So this is something small I can say about why the insulin was being administered. Provided daily wound care using aseptic technique. Aseptic technique means a sterile technique that's free from contamination. So whenever the person wound was being care of, they make sure the technique that they are using is free from what contamination, monitored vital signs and signs of infection, assisted patients with hygiene and mobility, educated patients on proper medicine use, diabetic diet, foot care, importance of regular hospital follow-up, encourage fluid intake and adequate rest, provided psychological support and reassurance of the patient. So these were the nursing management or the things that the clinical practitioner did to manage what's the situation to prevent adverse conditions. The next parameter we'll be talking about is what makes the case special. In talking about what makes the case special, for this one, we want to know we have so many diagnoses, we have so many diseases that is existing in the world. So why did you choose this specific disease? Why is this disease so special to you? Why are you interested in this kind of disease? So in presenting your case, you have to add it. So what makes the case special? This case was special because the patient had lived with diabetes for several years but had poor compliance with treatment. So the person was having this diabetes disease for so many years, but for the treatment he or she was being given, it wasn't really um, it wasn't really corresponding to his or her health. So the person wasn't having a complete compliance with the treatment that he or she received, and his condition worsened due to lack of knowledge because the person doesn't have any knowledge or because he doesn't have any knowledge about the condition. There are some things do's and don'ts you have to do, but since he don't know anything about it, he will go and do it, which will alter the treatment being given to suppress the condition. Financial constraints, a late presentation to the hospital. The presence of diabetic foot infection increase the risk of complications such as amputation, making prompt and careful management very critical. So because the person was also having a diabetic foot infection, there was a risk of the foot being cut off, being amputated. So these scenarios or these things that we've talked about made a person very interested to write a case presentation or present on that case. So the next item we will talk about is the learning point. What the person who wrote this case learned from it. So from this case, I learned that poor drug compliance can lead to severe complications, early detection and proper control, blood sugar prevent long-term complications, patient education is important as without therapy, diabetic foot care must be never be taken lightly. Teamwork among nurses, doctors and laboratory staff is essential for good patient outcomes. So the last thing that we will talk about is what I will do differently next time. So if I meet a similar case again, I will emphasize patient education more, especially on drug adherence and lifestyle modification, assess patients early for complications, encourage family involvement in care and treatment, monitor blood glucose more frequently, and advocate strongly for early hospital reporting when symptoms begin. So these are the things that was required of us to include in our case presentation. So the parameters that we followed in writing these case reports or case presentation was that firstly, we needed to write the patient particulars. The patient particulars, which consist of the age, the sex, the date of birth, occupation, education background, and the condition. The next one is the condition. Then the condition consists of the compliance, assessment findings, diagnosis, lab investigations, and treatments. The next one was nursing. The nursing entails the nursing diagnosis and the nursing management. The next item was what makes the case special. What makes the case special? The next thing we considered was the learning points. What was the lesson that was learned in this case? What lesson did you learn from this case? And the last thing that we considered was what will you do differently if you meet such case again? If you meet such case again. So for this case presentation, these were the parameters were we followed in writing this case presentation. So whenever we are being given any assignment or anything to write about concerning a clinical case report, you can use this structure to write about it. You can use this structure to write about it. So basically, for case reports, what you have to know is that for case presentation is different from case reports. Case presentation, we normally use PowerPoint to write or to present. For case reports, you can use Word or PDFs to write your case reports. And for case presentations, they are being done orally. Yes, they're being done orally. So, but mostly they are being written for us to have a structured um, presentation. They are being written using the PowerPoint for us to have a structured presentation. By looking at case report, for instance, for case report, for that one, it is being written. You can write a case report without presenting it. But for case presentation, as soon as you get the structure or you write it down, you have to present it orally. So you can use this structure to write your clinical case presentation. You can use this to write your clinical case presentation. There are some institutions which can give you some parameters to use as well. So for that one, you can include it or you can use this sample to write it. So the samples that we used, they are the basic ones. Most clinical schools or most clinical practitioners, they follow up to write their case presentation. So in case you have some other important things to add in the case presentation, you can do so, but it has to be relevant. And when you're concluding the case presentation also, you can add your concluding remarks or you can add anything that will be essential or that will make the presentation perfect. Yeah, so thank you.